Iowa Department of Health says nearly 1 million more Iowans will be eligible for the coronavirus vaccine next week. But at the same time, many counties are warning the wait is not over. Good evening, I'm Erin Kiernan. Thanks for joining us this Friday. A third vaccine is now available, and shipments of doses to Iowa are slowly increasing. But that still isn't enough for many counties to expand vaccinations. WHO 13's Monica Madden joins us now. Monica, a lot of counties are still focused on the top tier of vulnerable Iowans.
Yeah, they are, Erin, and that is a setback for Iowans with any one of these pre-existing conditions. The Iowa Department of Public Health says Iowans who are 18 and older with a chronic medical condition like one of these can start getting the vaccine on Monday, but Polk County Health is holding off on that expansion until at least 70% of those currently eligible are vaccinated.
I was a little surprised.
With the state public health department announcing Iowans with chronic conditions can now get vaccinated, Polk County is holding off.
It just doesn't make sense for us to open it up and have a lot of individuals only having that one dose when we're really trying to make sure everyone is fully vaccinated.
That could be a while based on how long it takes to get 70% of healthcare and essential workers their second doses.
People in this new group have to be patient.
And when Polk County residents with chronic illnesses are able to get inoculated, providers aren't exactly sure how to verify that information.
Right now, it's just on an honor system. And if somebody walks in and we have the vaccine available for that group, right now, all I can go on now is what the patient tells me.
While a doctor's note might help, some illnesses the CDC lists may be harder for pharmacists like John Forbes to substantiate.
A person, I suppose, could walk into a pharmacy with a pack of cigarettes in their hand and say, I'm a smoker. Now, how do I verify that they do really smoke?
The Polk County Health Department says that is still in the works.
Kind of a subjective way of administering the vaccine based on what a person tells you. I can see some people trying to get a vaccine where they may not really truly qualify for that.
Forbes says calling individuals' primary care doctors may be the best bet, but that would be yet another time-consuming step to an already delayed effort.
We're trying to really focus on as many vaccines in people's arms, and if we have to take that time to call providers and get verification, that's going to slow the process down.
Again, Polk County plans to expand eligibility once 70% of the people in these groups you see here are vaccinated. And Erin, county leaders tell us they are currently at 66% of these groups, but they're not sure how long it will take to hit that 70%.
Yeah, as we've learned over the course of all of this, it's very hard to predict.